All right, keep in mind throughout this video, the left leg is the problematic leg. I will say the issue was more upstream at the hip, but when we looked more local to the hip, there wasn't a whole lot that stood out. Really good symmetry, good range of motion, good capacity of some of the musculature until we put him in a single leg squat. And that's when clues started to come from the surface, but it was more downstream at the knee and the ankle and the foot. So that's what we're gonna look at here. I freeze framed both of these two single leg squats at the bottommost position. So this was his maximal depth on the left, maximal depth on the right. And a couple things stand out right away. I think one being that there's just sharper angles both at the ankle and at the knee on the right side. What that tells me is he's getting his knee further past his toes here versus over here. And he's getting a better knee bend, right? So that's like, 90-ish degrees of a bend. This is probably more like 70. So he's getting deeper into this right knee. What that tells me about the left is that maybe the quad, maybe the calf complex has a lower ability to decelerate his center of mass on the way down. And because of that, there's going to be an energy leak where he's not going to be as good at redirecting his center of mass upward as he comes out of that squat. What that might mean at the hip is that it's going to have to be kind of doing the job, for lack of a better term, of what the knee and the ankle are not doing. So the knee and the ankle are not really pulling their weight. So that work is going to have to be exported to a different joint upstream. And so the hip starts behaving a little bit differently. What we're really going to want to do at the level of the knee is just get really strong in our quads. So that if we can raise the capacity of our quads, that's going to help the deceleration capacities of the quad across the knee. At the ankle, what we're going to want to do is improve the overall mobility of the ankle as well as the rear foot and the midfoot. And so a couple ideas here. Eversion, ankle eversion, which is the tilting of the outside of the foot upwards, is really important in order for our knee to be able to get over our toes like this. So we need to be able to get that slight tilt, particularly of the back of the ankle, like that. And then a couple other options that we have here is just working on flexion of the big toe and the other toe's knuckles. Like that, kind of like you're making a fist with your foot. Also really important for end range ankle dorsiflexion. Last but not least is just mobilizing the arch, the longitudinal medial arch here. So when the knee is straight, you have a lifted arch, but then as you shift into that knee bend and load the quad, you should actually feel as though your arch is flattening out and squishing into the ground. I've got a sock here as a reference point, so I'm trying to lift off the sock and then as I bend, squish into the sock like that. So just a couple ideas for early interventions to try to mobilize the foot, the ankle, and then also just work on overall loading capacity of the lower limb, the knee, and the quad.